Good afternoon, everyone. Thank you for sticking around. Welcome to the Student Experiences panel. My name is Abby Smith, and I'm the program manager with YIGH. And we have 4 students here today that will be representing different programs that we have at YIGH that I have the pleasure of supporting. So on our end, we have Jack Carew, who is a YSPH PhD student. Then we have Mohammed Ahmed Rami, who is with Yale School of Medicine, Christina Panzer with Yale School of Nursing, and Shankiri Viju Kumar with Yale School of Public Health. What I'm going to do is have them introduce themselves further, as well as the programs that they're here representing today. I have a few questions that I'll be asking them, and then I'm going to turn to you all for the question and answer period. So start thinking of some good questions now, and thank you for coming forward and being here in the afternoon. So, Shankiri, I will start with you.
All right. Hi, everyone. My name is Shankiri Vijay Kumar. I am a second-year Master's of Public Health student in Social and Behavioral Sciences, and I'm here representing the Leadership in Global Health Fellowship. So this program brings together a cohort of students across Yale, undergraduate and graduate students, and it connects us with a summer placement at leading global health organizations. So last summer, I did my placement at UNDP, the United Nations Development Program, and I was working as a health fellow. I sat in their health and development team in New York City, and I worked on policy briefs, research and development about communicating guidance on how to advance the Sustainable Development Goals through a focus on NCDs and mental health. And through this program, there was also facilitated professional development and mentoring opportunities. So sent us out into the world, but also brought us back together many times throughout the summer. So really excited to be here today to talk about that.
Hi, everyone. My name is Christina Panzer. I'm a psychiatric mental health nurse practitioner student at the Yale School of Nursing in my last year. And this spring, I had the opportunity to participate in the Yale Institute of Global Health's case competition. So this event brings together students from Yale College, the Yale School of Public Health, all the health professional schools, School of Medicine, School of Nursing. And we all get assigned onto teams. This year there were 7 teams, and we were presented with a global health case. Excuse me. And we have 2 weeks to propose a solution to the case we were given. This year it was about food insecurity in an indigenous community in Ecuador, in the Ecuadorian Andes. And so we presented a 10-minute long solution to a panel of judges made up of Yale professors. And on the competition day, we were also given a case twist. So if we make it into the second round of our case presentation, we have 45 minutes to alter our whole entire presentation and present it again to the panel of judges. This year, it was a budget cut twist. So we had to scale our solution down to basically half the size, which was a great learning experience. I really enjoyed it, and my team won, and we got to represent Yale at Emory University's case competition, which happened a couple of weeks ago.
Hi, everybody. I go by Rami. I'm a first-year medical student at the Yale School of Medicine, and I was really lucky to participate in the study tour to Washington, D.C., and so we learned a lot about the intersection really between global health and advocacy. And it was really a great opportunity to learn from people within, as people say, they're inside kind of the Beltway, and really understand a little bit more, not just about think tanks, but also learn from the policymakers themselves, whether that was with, for example, the Center for Strategic and International Studies to Gavi Alliance, and really learned a lot from them. I consider I would have loved in another life to be a diplomat, and I think that it really marries, I think, global advocacy or global health and medicine, a way in which like you can participate in leveraging that kind of privilege of being a doctor to really bring healthcare to a lot of different settings. And this really stems from a lot of the work that I had done before going and picking kind of medicine as a career path. Working with the United Nations Development Program, similarly with the Global Fund on HIV, TB, and malaria programs. And so, yeah, I'm excited to talk with all of you about the program that was really incredibly implemented.
Hi, everyone. My name is Jack Carew. I'm a second-year PhD candidate in epidemiology and microbial diseases. I study malaria epidemiology in Sunil Parik's lab. And this past fall, I had the opportunity to participate in the Sustainable Health Initiative Venture Development Program, which is an entrepreneurship program out of the Institute for Global Health and the Sustainable Health Initiative that gives students the opportunity to bring an idea, whether that's just an idea, an early stage, a concept, an idea for some innovative product in the global health space, or an organization that's further along in the development. And benefit from the tools at Sci-City for innovative thinking and the other resources that exist on Yale's campus to really bring that idea to fruition. So in this cohort, I was representing Respond Crisis Translation, which is a nonprofit that provides translation and interpretation services to asylum seekers, refugees, and anyone who's experiencing language barriers or has language, anyone for whom language access is a barrier to accessing care or services in a legal setting or in a medical setting or in an education setting primarily. And so I participated in this cohort with a number of other startups and nonprofits. We all had the opportunity to learn from each other and then also from the wonderful mentorship from the folks involved with the Sustainable Health Initiative, as well as guest speakers, alums of YSPH, or other folks who have been affiliated with YIGH.
Thank you all. So the first question for the panel, and anyone can answer in whatever order you all want, is what is the biggest learning you had?
I can start. I think one of the biggest takeaways and one of the things that made the experience so valuable about the case competition was the interdisciplinary nature of it. And I think I learned how to think about global health challenges and solutions in a way that encompasses many different perspectives beyond, like, my degree is clinical, but I learned to think about it in a way that thinks about, like, public health issues and technology issues and environmental issues. And also the panel of judges that we were presenting to also had a variety of backgrounds. So we had to think about, like, for example, like the business aspect of our solution, like how it's going to be sustainably funded. We had to think about stakeholders in the country we were proposing our solution and really just like the practicality of the things we were proposing. And that was just a really great, well-rounded learning experience, I think.
I think one of the greatest learning points during the study tour was that by having all of these kind of silos within the advocacy space, it can sometimes create these artificial divisions between people who have similar mission statements, whether it's, for example, Gavi and the Global Fund, et cetera. And especially and one of the hardest questions and kind of that I think made that learning objective come about was, what is the future direction of global health in the current kind of landscape and as it evolves? And I remember very distinctly, like, walking through the Capitol Hill, through the museum, and kind of walking through, seeing all the different statues. So every state gets to send two people that they want to represent, not represented, but like their stories or their kind of legacies being represented on Capitol Hill. And every single person, had done something that is different in their career trajectory, but all kind of for the greater benefit, for the greater good of society. And I think it was really a beautiful representation that all of us can be working towards the same end, but only through that form of collaboration will you see that, these kind of objectives reached at a faster pace. I think that there's this saying, if you want to go fast, go alone. If you want to go far, go together. And I think that really was represented through that study tour and all these different panels. Yeah.
I would say a big learning moment was just seeing how I could take my classroom learning and apply it to a really tangible project where I was engaging with a lot of current global health issues. I think a really profound moment was, there can be a lot of information overload in so many spaces. And so I was doing a lot of desk research, and I realized how critical it can be to recognize underutilized mechanisms while prioritizing really critical development issues that are a priority right now to advance progress on global health. So for example, I was grappling with environmental sustainability, not only with our built and natural environment, but also the human health side as well. So, we were talking a lot about we can communicate policy and guidance about planting trees, enhancing green spaces, which is really great for carbon capture. And at the same time, research also tells us it's really crucial for early childhood development, mental health, creating walkable spaces for people with chronic conditions. So what really came out of that for me was this co-benefit approach. So there's a lot of existing mechanisms and infrastructures that we learn through our public health education. And sometimes it's just a matter of reorienting how we're seeing some of these issues and communicating it to key decision makers. So a really big learning moment for me was that it's not always about reinventing the wheel and trying to come up with something new. A lot of times we'll usually know it in the back of our minds or have it in our back pocket, but it's really reframing it or reorienting it for the right audience.
That's a really good point. I think that really, flows nicely into the point that I was going to make. One of the big emphases of the Sustainable Health Initiative program was on communications. And so a lot of the program focused on giving us the skills to develop and give an effective pitch to a panel of funders. And the program culminated in an opportunity to pitch your ideas to a seed funding agency. But throughout the program, we're thinking about ways, how can we effectively address the wants and needs of those funders? How can we both answer their questions and then also, perhaps tailor our idea or our mission to the specific criteria of this granting agency? And I think maybe Christina, you talked about this a little bit, or Rami, but the idea of transferable skills or things that might be applicable from these experiences that we've had into other things. So I'm oftentimes presenting my scientific research and thinking about how to tailor that to different audiences. If it's an audience of epidemiologists or parasitologists, you might have different things that you emphasize. And I think that there certainly were things and lessons learned from the venture development program from SHI that definitely touched upon, understanding your audience, how to communicate effectively with them, and kind of what are the main points you want to get across, and then what are the most effective strategies you can then employ to get those points across.
Thank you. So Christina, in terms of the Global Health Case competition, what practical skills did you learn through participating with the competition?
I learned a lot of practical skills. I think something that was very notable for me on a personal level was increasing my confidence with public speaking and the ability to present a solution in a concise amount of time. I think it was really great that something that the competition required was that everyone have a role in speaking, at least at the Emory competition. We all had to participate in answering questions, which can require being put on the spot. And it made us really think critically about how to prepare for any question that can be thrown at us. So I feel a lot more confident in those skills and my ability to present a solution in a concise manner. I think that was something really practical I took away.
Thank you. Shankiri, in terms of leadership in global health, what did you learn about working in a large global health organization? And I'll let you answer that first, then I'll ask the second question.
I learned so much. I think one big thing I learned working at such a large organization was the complexities involved with managing different health initiatives. And, there can be this tension to manage these global goals and global needs while also looking at local needs and local communities. So it's not only about, I learned, just having expertise in public health or climate change or public financing, but also understanding how important collaboration is and understanding this intricate web of stakeholders. So not only government bodies and local organizations or international bodies and grassroots health workers. It's really understanding how you can bring everyone to the table and do work that is reaching the people that need it the most. With global health, there's so many actors at the table, and so managing this need of pushing progress on global goals, but also making sure it's relevant to the people that need it most. I think that was a really big learning moment to know whenever you're communicating something or putting out an initiative, really honoring people's local needs and what's really relevant to them right now, right here.
Thank you. I love the theme of collaboration on this panel and throughout the day. What did this experience teach you about what kind of leader you are or would like to be?
I think what this experience taught me, I think an effective leader in global health is, I don't think you necessarily need to be the loudest voice in the room. I really learned how being a thoughtful listener and someone that creates space for diverse perspectives is really important. And that's something I really want to continue with my public health work. There's this moment where when I was doing research for the policy briefs I was developing, I was kind of given these 3 abstract areas and tasked with doing environmental scans and literature reviews and just validating if that's what people are really looking at right now. And as I was doing my research, there was this other priority area emerging. So I went back to my team and my supervisor and I advocated for that. And they were like, yeah, this is something that's emerging, and that ended up being pushed up. So it really taught me, if you're seeing something, if you're hearing folks discussing a critical issue, making space for that and for conversation to make sure a lot of voices are being heard. And with public health and global health, especially in current times, there can be a lot of ambiguity and a lot of uncertainty. So going forward, I know I do want to be a leader that can lead with empathy and is creating space for a lot of people and can lead people through a time like that.
Thank you. Jack, how did being a part of the Sustainable Health Initiative Venture Development Program support your venture Respond Crisis Translation?
So thank you for your question. Like I mentioned, it first of all allowed us to get a lot of practice kind of telling our story, communicating our message. I think that the coverage of our participation in the program was extremely valuable. We were able to, there was a piece about us, I think, on the YIGH website or on some like Yale news sources. So I'm kind of leading on academic partnerships at Respond Crisis Translation. So since participation in the program, have been reaching out to students, faculty, et cetera, for folks that might be doing work in contexts for which they might need translation or interpretation support. So, this is also, a call for that if anyone here is interested in that and wants to get in touch. But yeah, so because so much of our work in global health and public health in the US or outside the US involves working with communities who speak other languages or languages that aren't English or languages that aren't the primary languages of the countries, I think it's, really important to make sure that public health work is accessible to these different communities. And through the venture development program, we've been able to, reach out to different folks who are affiliated or not affiliated yet with YIGH to, spread the message that language access is important, and then be able to provide some language access services for different public health and global health projects. So while I don't have like a new partnership to point to per se, there are some that are in the works. And I think too, I want to kind of, again, circling back to what Abby mentioned just now about collaboration, one of the largest benefits I think of participating in the program was the opportunity to meet with other new ventures. So we learned about other students who were providing education services about menstrual care in Nepal, for example. And Nepal is a very linguistically diverse country. And so if one is providing language services or education services there, then there's going to be a lot of different linguistic needs or languages that might be relevant for those education sections. I think that group is called PRA, if anybody wants to look them up. They're incredible. So yeah, and I think we've met other groups, both through the venture development program last fall and then through our participation in Startup Yale last week, that are affiliated with the School of Public Health or the other health professional schools that are addressing these really important challenges to global health and might need language access support. So I think really the new partnerships and the communications, et cetera, have been some of the most valuable things that we've gained from participation in the program.
Thank you. Rami, how did this trip to DC shape how you view U.S. global health policy and advocacy and your role within it?
So my previous experience was never within the U.S. policy landscape, and I think that was part of the reason why I was really excited to go on this study tour. And I think the U.S. particularly looms very large within the global health space in general because of the amount of funds that it provides. And so I was excited to hear from the NGOs as well as like people who are in policy making. And I think the way that it influenced me was there was this one panelist who said, like, be unreasonable. And I think that really stuck with me in the sense that you need to know what you want to be unreasonable about. And I think right now we're at that juncture where you can pick what you want to be unreasonable about because everything is in limbo. And that pairs up with this other idea of when I was seeing at least Laurie Mignon, she is on the Appropriations Committee on behalf of the senator. And essentially these four corners, so the House majority, House minority, Senate majority, Senate minority, have to sit together in a space and like come to essentially a budget that they all agree on. And everybody has to come to the table ready to wrestle on what they are going to be unreasonable about. And I think the way that she was talking about it really stuck with me in the sense that as much as you want to be unreasonable, you want to also know what you're willing to compromise. And so arriving to any form of decision making, I think, as a physician, as a person with that form of privilege, and being unreasonable, let's say, about a type of technology that you want to bring to a low resource area or anything, you need to be willing to also understand how you are going to compromise in arriving to that decision making or funding or anything. And so I think arriving to that kind of decision, especially within the US landscape, given the privileges and afforded by an education like at Yale, it kind of makes you think as much with a lot of the institutional backing that we have, a lot of the fellowships that exist here, how do you want to leverage it to be unreasonable about something? And how do you like continue that movement as you go forward from the US being kind of your point right now outward? So yeah, I hope that answers your question.
That does.
Okay.
And I see some of your colleagues nodding in the front. So I think that you have support with your answer as well. I do want to look to the audience to see if we have any questions yet for our panel. Christina? They're going to come for the mic.
Thank you. Yeah, just saying thank you for sharing your experiences. As a student, I know how valuable this is for us. And I was wondering if these experiences change your, I don't know if understanding, but kind of your commitments/plans for your future. Like, do you, about global health also, because it's like you were in a challenging time. So I was wondering if this has kind of made you commit even more to global health, or perhaps the other way around, like, oh, maybe I'll change paths now that I know more about what it is.
Yeah, definitely. I think this experience has taught me that global health can also be local health. Coming into my master's program, I had a lot of community-based research experience and hadn't dabbled a lot in policy work or global health work. So I was really enthusiastic about this fellowship program. But, you know, being able to zoom out was a very enlightening experience. I learned so much working at a large organization and doing the policy work that I did. But it also taught me that I don't need to let go of local communities or local needs. There is a way to be able to do both and balance both. And I think it's important to have people doing local work, global work, but also middle people that are able to bridge those connections. So I think it was a validating experience to know that I can do, work in different levels of impact doing policy work. And I'll also say I was someone that had a lot of different public health interests, and I felt this pressure, I don't know from where, to commit to one or two things. But working at the UN taught me, you know, being a jack of all trades can be a really good thing. There's so many interconnections. So that was also another validating experience. I don't need to stake a claim. I can, do public health and global health work in a lot of different areas. So it definitely was a validating experience, and also really motivated me to feel that there's a place for everyone in public health and global health work, because we really need a lot of diverse perspectives and those unique perspectives that are willing to bridge a lot of different sectors.
Us generalists are cheering right now, so I see. Anyone else want to answer the question?
I 100% agree with that. I think the experience through the case competition was really inspiring, especially getting to go to Emory, where all of these people from different schools in the US and also some from around the world in other countries came to Atlanta to participate in this case competition. It was great to be surrounded by other people who were also very excited about the future of global health. And I think something to think about, like in my future career that really inspired me, part of the case competition emphasizes innovative solutions. And so many of the solutions proposed were based on like new technologies and really like out of the box creativity. And I think it made me really excited thinking about the ways like technology and new developments such as like AI can be leveraged, especially to meet vulnerable populations, whether it be locally or globally, and that there are so many directions to go in global health and public health. And yeah, I think something else to like I would recommend for people who are also passionate about global health is to really like form community with other people who are as excited about it and just share ideas, because that was really great and inspiring.
I think it's a great question. I would be lying if I said like it was really all rosy. I think it is very tiring to see like checks and balances being chipped at. And I think what was, I think, reinvigorating and allowed for that form of recommitment is seeing that you can't really move the rock like all by yourself, and that you have enough kind of champions within a collective to be able to push it together. And the more people kind of, you know, throw the hat and just say, oh, like I won't do this work, the less champions there are and the heavier the rock gets. And so I think seeing kind of, you know, the US, for example, say, we're going to pull out of the WHO, like here's our notice, or, you know, we're going to defund X or Y or Z, is devastating for a lot of people. But the way that we at least were learning about it, like through the study tour, is that you kind of deal with things as they come and you have to be agile. And the only way you're able to be agile is being able to be connected to right people and being able to, similar to what was said before, like you need to be able to know how to couch like a certain word or a certain phrase or a certain policy in order for it to be kind of accepted. And so I think that recommitment was just seeing and reflecting in others and that collective kind of doing that work and feeling you need to be part of this if you want to be unreasonable about it, right? Maybe this isn't the thing that like you want to be unreasonable about. So,
I mean, you all already said so many great things. I just will quickly add on that, you know, in kind of this like continuum of local and global and, you know, different levels of health, I think that, you know, we know that language barriers are pervasive and deadly. They're not going away. People, you know, will continue interacting with folks who speak different languages, et cetera. There will be a need for this. And whether that manifests as, you know, translating surveys into Acholi or Luganda for work in Uganda, or whether it translates to, you know, writing an abstract of an article or writing an op-ed in an article in French in Yaoundé about a malaria diagnostic device, or whether that means, you know, conducting focus groups in Spanish or Pashto or Dari in New Haven. You know, these language issues or language access exists everywhere. And so I think that, you know, participation in the venture development program with SHI, you know, helped to, you know, helped me to see kind of the different ways that this work can complement existing work, right? Can complement malaria dissertation work or, you know, other projects that folks are involved with at the school or elsewhere. So, yeah.
Thank you.
So Abby, thank you for moderating this great panel. You guys are amazing. And the only thing that makes me sad about this session is that it's the last one of the day, and I think it should have been the first one of the day, because there should have been more people in this room to hear your voices. So in that spirit, my question is, you know, you guys aren't on campus for very long. When you are on campus, how can we, as YGH, do a better job at hearing the voices of students and engaging you in decision-making and contributions that are meaningful to the Institute?
When you say decision making,
Now you're quiet?
when you say decision making, what do you mean by
Yeah,
that?
so
Is it-
meaning when we come up with when YIGH as an institute on this campus is designing programs or project ideas or right, I'm not necessarily talking about large funding decisions or whatnot, but yeah, sort of the path, like how to chart the path forward, how to do a better job at engaging the student voice in charting the path forward.
I would say now, especially one thing, I've been hearing amongst my peers that people really value right now is just being in community, just having casual drop-in spaces with like staff, faculty, students from various departments and program, just to have that space where folks can, share collective interests or just talk about current times. I found there's, a lot of students really want that and appreciate opportunities like that. And I've also found, being in rooms like that, a lot of wonderful discussions can happen. And it's always lovely to have faculty and staff there that are doing work and really well connected at Yale, because usually they'll have a pulse on like, oh, you're interested in this or you want to get involved in that. I have something or I know someone. So I think just drop in casual spaces. Usually if there's food, I've heard it's very popular. I think we always love being able to connect with people that we normally wouldn't run into in our classrooms or in our own departments. Like really low effort, low lift. It doesn't need to be grand.
I'm going to give you an idea that happened in my master's program, and I think it worked really well. There's this idea of like every single master's student or PhD student, Exhibit A, is obsessed with something, right? Every single one of them. Obsessed about some random thing in the world. It doesn't have to be about public health necessarily. And I think it speaks to the idea of community, which is you can have something called like, I don't know, like something briefs or whatever. And you have students, let's say they'll give like 3 to 5 minutes about something that they're obsessed about or something that they did in their gap years. I genuinely believe that every single person here at Yale like has an incredible thing that they did that they never talk about. Or they know something that I have no idea how they know it, but I would love to like hear so much more from them about it. And I think as much food, if you have just a little bit of drinks, like people will love it and people will flock to it. And I think it goes to the idea of creating tradition. And so this thing that we did in the master's program was like every 2 weeks we'd gather in the pub and like you're just hearing like your friends talk about something that they're obsessed about over drinks, and like everybody's really attentive. And it could include faculty, it could not include faculty. That's kind of your decision. But allowing those kind of creative spaces to exist where people can talk about things that is just constantly on their mind creates that idea of community. And it could be, related to public health. But people are far better team players when they know each other, right? And that just is I think something that Yale can afford and can make as part and parcel of a tradition in the school. So yeah, we still joke about all these different briefs that happened over the masters. So yeah, it worked out.
I think in addition to that, more global health on taps, and then also just like, I think that sometimes it can be challenging to know about everything that's going on. And, people always say like so-and-so siloed, et cetera, et cetera. But, I almost wonder if there could be like a lightning talks. I know at the beginning of the year, I think sometimes for EMD seminars, some faculty in EMD will come up and say, this is what I do, maybe more at like a master's audience in terms of thinking about thesis, et cetera, et cetera. But if there was something where it's like, here are all the different programs under the YIGH umbrella, if it's, the different research programs, the different innovation programs, the different trips, the different fellowships, et cetera, and just, getting a better idea. And then also if there can be a better way of kind of publicizing those, through, I know sometimes there's like an ID grand rounds or something that I'll hear about from people in my lab that's global health relevant, but maybe not on the YIGH email list, which I think is, challenging because there's so many great initiatives and centers, et cetera, that are all, global health touches so many things. But yeah, I think just, having it be easier to learn about these things and knowing who people are and who to get in touch with if you're interested. Like Rami was just saying that he's, potentially doing something in Malawi this summer. I didn't know that anybody did work in Malawi at Yale, but that's so interesting. So yeah, I think just kind of having more ways to get the word out would be great.
I have one more idea for you. So do people here have like these 3-minute theses? Do people do that here too? Like 3-minute? Yeah, right? So you could reverse that and have like professors present their research in 3 minutes. And it's fun, it's exciting, it's like really putting on the other shoe, right? And I think that that's something that would be well attended by students, and they can learn about everything without like listening, to a panel over the course of 30 minutes of the same person talking about their research. And I don't know. Yeah, in the medical school, we have something like called an advisory group where you'll like randomly on a lottery basis, people who sign up to kind of like talk to professors and offer their feedback on courses or the school. Also provides lunch. But it's a lottery system so that you don't kind of pick and choose people, but rather like they want to give feedback. They're excited to do that.
I can share too. It sounds like food is a common consensus and how to engage people. People love events with food. I'd also like to echo what something that Jack said about there are so many great opportunities at Yale, and I think sometimes because they're like all in different departments, I'm in the nursing school, so it might be different like depending on the school too and everyone's experience within their school. But sometimes it feels like you have to really seek out opportunities, and maybe like there are so many faculty at my school that I didn't know do like great global health work unless I read about their faculty profile on the website. So I think, really holding space to engage in like collaborative activities. I love the idea about the like flash talks and having students and faculty share about their work. But really, I think increasing collaboration between like the health disciplinary schools, maybe even having like social mixers and things for students to get to know each other better and share interests and things like that would be really great. Thank you for your question.
Hi, this was a great panel. Really lovely to hear all of your guys' thoughts. So I'm a recent graduate of the undergrad in the history of medicine, and so I wanted to hear some of your thoughts about like your early career, and also kind of going back to the idea of being a generalist or kind of having something that you specialize in. Can you guys talk about each of your kind of pathways to what you're studying now, and also any of the different like maybe leaps or like unexpected turns that you may have taken unexpectedly, or something that was kind of like out of the box that ended up kind of really helping and shaping what you actually like really like to study?
I think I kind of touched on like how I really started off with community-based work and got more global health and policy experience. So I'll answer this question a little bit differently, but one really profound moment that myself and a lot of people had through this fellowship, we had a lot of really great guided mentorship opportunities with Abby and Lauren. And one thing we discussed a lot about is like, what is our role in global health work? What brings us to this type of work? And a discussion that was a recurring theme throughout the summer for us when we got together as our cohort was, do we want to be an inside or an outside person? So I would say for folks that are navigating the public health and global health space, really think about that. And sometimes it involves taking on different roles or working within one place or one sector and taking on different opportunities to learn that about yourself. I felt like, working at a large global health organization, that I was an inside person. So I was really getting to know the system and how public health work and global health work is approached through one very specific perspective, but also working within the structures that has been set out. But also at the same time, we're collaborating with people on the outside that are, advocating and are boots on the ground. So that's also a completely different perspective, but also very valid. And so I think one key theme that I keep throughout anything I do is like when I'm at an organization or I'm in a program, am I taking on an insider perspective or an outsider, and what can I learn? Because I think there's value in having both, but also bridging that together. So a lot of about connecting and bridging. And I think that was a really profound moment for a lot of us through this fellowship, was thinking about the space that we take up in global health work and how that shapes what we want to do next. So that's something that I pass on to everyone in any organization you're in, to really reflect about that. And is that something that is meaningful and feeding your soul, or is it time to try the other perspective or be someone that's bridging both?
So fundamentally, like, your question is kind of part of your question is like being a generalist or being a specialist, and how do you kind of navigate that question like post graduation, right? So medical school is a very long career, and they tell you like try as many things as you can before you pick it, so that you are really sure that this is what you want. So I think I did exactly that. And so I took like 6 gap years where I was like, I want to try every single thing that I could. From the generalist perspective, like, I had done consulting, and I think one of the things that you want to kind of ask yourself is, do you enjoy being a jack of all trades, or do you want to be a master of one? And whenever people contextualize the question to me in that way, it frustrated me, because I felt like I needed to pick one or the other. And I think that life is beautiful, and there's so many things that I want to like go and see and enjoy and be able to do. But after like post-graduation, I think one of the things that I was looking at was fellowships that would allow me experiences that would clarify that for me. I think Yale has an incredible amount of like fellowships. At least I'm signed up to the Office of Fellowships, and they always send all these different things. And I would take advantage of that, in the sense that, like, find a question that you kind of wake up and sleep thinking about, and see a way to like pursue answering that. And I think that that's the first kind of jump at taking kind of a role on as a specialist and being able to try to understand it and look at it. For me, for example, I was like looking at how do refugees recreate home, and I was obsessed with this idea of home and what does that mean for them. And that took me on a journey of a year that led to a different year, that led to a different year. And I think it would be hard. I would be hard pressed to tell you like this is exactly how it's going to go, but you can choose how that first pivot point goes. And if you become a generalist, then you're asking yourself like, is this what's fulfilling for me? Like, do I enjoy all these different, like, do I enjoy just being on a different project every 6 months? And like, I'll know a little bit about here and there. Or like you want to obsess over a question and try to answer it. And maybe that will lead you down a PhD route. Like you don't know, but the first juncture is really important. And you just want to be able to like see all the available opportunities and pick one and be on firm footing while you're taking that decision.
I was just going to add to that. I think also like finding out what you're good at and like what brings you joy in doing. And it doesn't have to be like a specific population, but like for me, one of the things I found that I liked is finding like ways to improve processes or improve efficiency and effectiveness. And the only like kind of through line for me has been that it is related to like health equity. So I think for me, like I've done Peace Corps in Botswana and worked at an AIDS clinic in South Africa. I have a degree in social work and public health, and now I'm going back for more public health school. But like realizing, taking the step back and like, what is it that I am good at and that makes me happy? And it doesn't necessarily have to be like working with one specific population for me. It's really like reaching minoritized and underserved populations as a whole for me. But Jack, you wanted to say something too.
Yeah, I just would add on to that. I think I agree with most, if not all, of everything that everyone has said. I think another layer that I would add to that is, things that you're good at or things that I'm good at, things that I love doing, and then also communities that I love being in. So like people that care about similar things as me. I think that, so I'm a PhD student. I think, one thing that's inherent to a PhD is that you need to focus on one thing for 5 to 7 to 8 to 10 years, So who could say? And similar to many other people up here, we have many passions. We love doing many other things, And I think that's kind of a tension that I've been navigating. But I think that, one thing that really drew me to doing that, to, becoming a specialist in malaria epidemiology, to the emergence of drug resistance in East Africa, is to get the skills to be most effective in many different contexts in the future, that going on this very intensely focused journey for a number of years will then give me those skills to be the most effective in the future. But I also think that there's no rush. I think that after I had graduated from undergrad, I thought, what's next? Every, step is very important. Every juncture is very important. But looking back, I think, I'm very happy with all the things that I did, whether that was studying leishmania in Morocco or doing breast cancer work in Jordan or Romania. I think it's all like, it all led to being here. And I love malaria now. And yeah, so I think try not to, I feel like I wish I had taken more pressure off myself, when I was taking these different steps.
Yeah, I think to also, emphasize what people have said, I think it's also a question for me personally of like where I can make the most impact, where my skills will be most valued, and kind of where I am invited to be a collaborator, especially thinking about in a global health setting, where I'm invited to be an ally. Instead of just thinking about, what am I interested in? I think it's important to think about both what will make me feel fulfilled, but what is ethical and what will actually make a difference in the communities that I'm working in. So to me, it's very important to keep an open mind. So I genuinely don't know where I'll be in the future. I think I'm going to work clinically for a few years and get a better feel for the healthcare system, and hopefully that will help me see where my impact can be. And what I'm really passionate about. But also, like, global health and healthcare locally as well is just ever evolving, ever changing. And so my interests will probably also evolve and change. And I've accepted that.
Do we have time for any other final questions? No one from the audience? We did have two final closing questions for you all, so I just want to, rapid fire if there's any last thing that you didn't get to say yet that you want to say before we close. Based on the questions we had, which were your career trajectory, has it changed after this experience, or do you have any advice for students interested in global health? Or you've said everything you need to say.
I have a question for other panelists. Oh. Can I do that?
You can take, go ahead.
What's a book that's inspired your global health work?
I read House on Fire about the smallpox epidemic and basically eradicating smallpox, and I would say that was very inspiring.
I feel like my go-tos are Spillover, the David Quammen book, and then also Mountains Beyond Mountains, the Paul Farmer book.
Bit of an unorthodox answer. It's this qualitative methodology textbook called Talking to Strangers. Huge qualitative methods person. I think stories are so powerful, and sometimes going back to the basics and realizing, it's powerful and important to talk to people and lead with their stories. So if I'm ever getting overwhelmed, it's like, let me go back to the basics. And, sometimes it's just listening to people, practicing active listening and connecting on a human level.
Is that the one by Malcolm Gladwell or a different one? Okay. I'm struggling to think of like a specific book about global health, but like that was one that actually really challenged me to think. The whole concept about it is understanding people who are different than you and how people struggle to understand each other. So I don't think it's necessarily like about global health, but I think a lot of global health work thinks about like understanding people that are different than you and understanding different like conceptualizations of health and like different cultures, and it requires a lot of critical thinking about our own biases and understandings of the world. So that's something that I think I really enjoyed that book, and it made me think critically about the way I think about other people.
Yeah, Rami, what about you?
Usually the person who asks the question doesn't respond, so I didn't think too much. But if any book, I remember in college, one book that really struck me was Letting Them Die. I think it was about this HIV project I think it was in South Africa, and like the utter failure of this really well-funded project, and like everything that went wrong, and like they're chronicling it kind of for the next person to not do the same. Yeah.
All right. Well, I want to thank our panel for sharing their experiences today with all of you. And I want to thank all of you for staying until the end of this day to hear from all of our panel. So thank you very much.
So thank you, Abby, for a great concluding panel. I know for me it's always super energizing and inspiring to hear from our students. I have the opportunity to engage with them in the Global Health Seminar in this classroom and in these programs, and I always come away very inspired by you all and energized by you all. So thank you all for being here this afternoon. So it's my job, because Dr. Capello had to leave a little early, is to conclude our symposium and just to say thank you all for being here throughout the day. It's been a great few hours or so together, a great learning opportunity, and also just a great opportunity to be in community with each other. I just want to take an opportunity to thank groups of people. As you can see, when you do these things, they don't just kind of happen. So I want to thank, we have some of our friends from Public Health and Broadcast Services. So I see Pete Donahue, Doug, who's behind the camera, John, Alex, our photographer here today. So why don't we give them all a hand? We have a great conference and events team. So Vanessa, who I think is kind of tired of taking Q&A today, and Natalia, who did just a great job. They're up in the booth there. There might be others on the conference and events team, but they always do a really great job. And certainly just want to echo Michael's comments and thank the YIGH team, our faculty, our staff. So I see Jeremy's here. I think Tracy must have left. To Christina, to Kaveh, I see, but also the team. So Enoch Carter, she had to leave a little earlier, but she's a really key part of our team. To Abby, to Fatima, to Alyssa, you all do such a great job, and thanks for putting together just a great day. So.